Hi guys. So I want to show you a PowerPoint that I made. It explains ABA a little bit more, and hopefully it's useful for anyone really, or anyone that is considering ABA. I know that as soon as you kind of get that diagnosis, it's pretty scary to see what's next. But as soon as you get an autism diagnosis, your next step should really be to look into ABA therapy, speech therapy, and occupational therapy for your kiddos. Occupational therapy may not be part of it, but ABA and speech therapy for sure. So I created this PowerPoint that it's ABA for parents. So some of the things that you should look for in your ABA providers, and some parenting tips overall. So in this video, I will stop at how does ABA teach my child, a variety of prompts. We will talk about the ABCs of behavior, functions of problem behavior, using ABC to identify function, teaching alternative behaviors, ABA tips, and insurance for other videos. I hope you like this one though, with what is ABA and how does ABA teach my child. First, I guess we'll get started with what is ABA. So ABA, first and foremost, is science and research based. So what it means is that there's a large body. So there's a large body of research out there that shows that ABA is effective for kids with autism in specific. In this graph, like you'll see, one of the studies done by Lova's young children between the age of 2 to 3 years old who received intensive ABA, intensive meaning 30 to 40 hours per week, had a better social outcome and adaptive functioning when compared to children that received no intensive ABA, right? So if you look at this graph right here, intensive ABA, out of about, I want to say it's about 30 kids, 47% started functioning at their peer level. In this study, it meant that they were able to go to a general education classroom with no help. With intensive ABA, 42% of those kids started functioning at a mild level. What that means is that they were able to go into general education with some help. And then those that received intensive ABA, 10% were still below peer level. So that means that they remained within their special education classrooms, and they made very little progress cognitively, adaptively, and socially. Those kids that received no intensive ABA, only 2.5% started functioning at peer level. So only 2.5 of those kids that had no intensive ABA were able to go into general education. And then those kids that received no ABA, about 45% of them did go into mild functioning. So that means that they were able to function in the general education classroom with some help, right? And those that received no ABA, 52.5% of those kids remained below peer level. That's a huge difference. If you looked at those kids that received intensive ABA, about 80% of those kids were able to go in the general education classroom, versus those that received no ABA, 52% of those remained in a special education classroom. Only 45% were able to go into general education classroom. That's a big difference. Now, I like this article the most because this is one of the first articles that shows that ABA is important to start young. The younger you start, the better the outcome. Okay? Why? Because kids with autism, it's a neurobiological disorder. So it's basically a brain disorder. It's a neurons are misfiring. They don't quite have it figured out yet, but they do know it's a brain disorder. So ABA functions in the fact that the younger we start, the more we're able to shape and mold the kid's brain, right? I don't know if any of you have heard of the term neuroplasticity. The younger the kiddos, the more neuroplasticity they have, the more that we're able to kind of change and shape their brains with some of the things that we try. I also like this article because it shows that it has to be very intensive. It has to be about 30 to 40 hours in order for it to show you the most effective results. And once again, it goes back to the more we're able to spend with the kids, the more we're able to kind of shape how their brain is developing. Because they picked this article doesn't mean that ABA is not effective for older kiddos. ABA is still effective for older kiddos. There's a lot of other research that shows that ABA can help kiddos that are older. It can help kiddos with conversation skills. It can help kiddos with self-help skills, such as showering, toileting, getting away from like always having to do their schedule in a certain order, things like that. So we know that ABA is research-based. Another thing that ABA does that none of the other therapies do is ABA focuses heavily on reducing problem behaviors. So we look at, why is your child headbanging? Why is your child throwing himself on the floor? Why is your child screaming? We focus on those problem behaviors and we reduce them, right? Reducing problem behaviors helps increase socially significant behaviors, okay? And we only do this by employing interventions that are research-based. So if you look at this little graph right here, we have, this graph only shows 27 evidence-based interventions, but I know there are more, right? I don't know how many of you have heard that ABA is only about sitting at a table and a chair. Well, that's not true, okay? ABA can be working in a natural environment, and this is where you have this naturalistic teaching strategies, or you have your parent training as well, where you have self-management skills, right? Self-management, so we can teach your kid how to dress themselves when they're in their bedroom, right? We don't have to do that at a table and chair. We'll do that when it's naturally occurring, when they have to get ready for school, or when they have to change their clothes after they have a pee accident. We didn't do those things at the table and chair. We also do a lot of parent training. That means that we have to work with the parent to make sure that the parent can do the skills that we're teaching your kid and show it to them. If the parents can't do what we're doing, then that's not good. We have to be able to communicate with the parents, but they can also do what we're doing now in ABA, right? So like I said, ABA teaches socially significant behaviors. ABA might teach your child how to look at an adult, how to attend an adult, how to imitate an adult, how to request for things, how to ask for things that they want. We might teach them how to properly play with toys, how to properly roll the car, not just to look at the car's wheels. We might teach them how to properly hold conversations rather than just saying the same phrase over again. We might teach some of these self-help skills like getting ready to go to school, getting ready to brush your teeth, getting ready to put your pajamas on. And then we might also help with some of these pre-academic skills, like improving fine motor skills. That helps with the drawing and helps with the writing and helps with, throwing balls too. I do want to say that socially significant behaviors are different based on the families. My socially significant behaviors are not the same as the next family's socially significant behaviors. This could be because it's a cultural thing or the way we were taught, right? Me, myself, I think it's very important that that we kiss when we greet. That's Spanish culture, so that's something that I like to see, versus someone that it might not be from the Spanish culture might not think that's socially appropriate, and that's okay, right? In ABA, we should talk with the parents and talk with the families to teach your kids behaviors that are important to you and your family, okay? Because we want the kid to be socially appropriate in the environment they're currently on. So it's really important for your ABA provider to talk to you and ask you, hey, is teaching him this or her okay to you? Or what do you think about it, okay? I always want to watch out for ABA providers that want to just, hey, we're going to teach him this, and they don't ask your opinion on it. Just be careful with those type of ABA providers. All right, ABA also decreases inappropriate behaviors. So we might decrease your kids throwing themselves to the ground, or hitting their heads, or swearing, or covering their ears, or lighting up cars or toys, hitting adults and children. Inappropriate hand movements, like some of the hand flapping that you might see, or like really looking at their fingernails, or placing items in the mouth. The list can really go on. Same thing for the teaching socially appropriate skills. And like I said before, you always want to discuss with the family, hey, is this a behavior that you want to decrease? Is a behavior that you want your child to no longer do? Okay? What's inappropriate to me might not be inappropriate to you. And that's okay, right? I might think that my child covering his ears is okay, and I don't want it to go away. And that's okay. It's okay, fine. You think it's okay? We'll work on the next inappropriate behavior. But there might be another family that might, hey, I don't like my child covering his ears. Let's change that, okay? So what else is ABA? ABA is also data-based. So in ABA, you'll have what's called sessions, where a therapist will come and they will work on teaching your child appropriate skills and work on decreasing those inappropriate skills. We want to make sure that that person that comes is constantly taking data to ensure that progress is occurring. This allows us to make changes to your child's programming on a daily basis. For example, if we don't see improvement within a week, then we have to change the way we're teaching your kiddo. Okay, if we see improvement within the week, then we're not going to change what we're doing. If we don't see any movement in a week, then we also have to change what we're doing. Okay. Ideally, you want to analyze the data on every 3 to 5 sessions. So you want to look for an ABA provider that is taking data every single session. You want to make sure you have an ABA provider that has the board certified behavior analyst or the QBHP come in on a weekly basis to look at the data. Because the BCBA or the QBHP are the ones that are going to analyze the data and say, we need to change this or we don't need to change this. If you have a BCBA or a QBHP that comes on a monthly basis or every 3 weeks, then there's a problem, right? Because now if your child is not learning something, it's going to take your child's going to keep learning it the same way that is not effective for 3 weeks until the BCBA or the QBHP comes in. What? That's crazy. That's just 3 wasted weeks. Where if a BCBA could have came in just a little bit earlier, we could have changed the way we were teaching him, and he could have learned that within 3 weeks, just because we made one simple change. So you always want to be careful, or those ABA companies that might want to get away with that. Hey, I'll come in once a month. Okay, another little tip, you can also look at consumer reports online to see if there has been any consumer complaints against the company. And sometimes you might find those complaints against the company saying that, hey, this company was not providing enough supervision to my child. So what else is ABA? ABA is also individualized. So it's one of the most important aspects of ABA. Every child will be working on a different skill. Every child will be working on reducing different behaviors. Every child will be using different research-based strategies in general. Right? Like I said before, what I want to work on might be different than what you want to work on. And that's okay. Right? You want to look for an ABA provider that will ask the parent, hey, what are your biggest concerns? What are something that we need to tackle right now to make your child more socially adaptable to his current environment, which is your home? If you have an ABA provider that is not asking you, what do you want to work on? That's a red flag. You're going to watch out for those ABA providers. You also want to watch out for ABA providers that might tell you something like, hey, he got a 65 in the ABLES, so we're going to teach him this, this, and this. Just because he got a 65 doesn't mean he needs to learn this, this, and this. Right? It has to be based on what he knows and what he doesn't know, or what she doesn't know or she does know. Okay? We want to watch out for like cookie cutter approaches, which is like, hey, this is what we're doing. This is what we do with every kid. Every kid's different. So the way we approach every kid should be different. So now we'll focus on how does ABA teach my child. And ABA teaches your child, like we talked before, using research-based interventions. Some of the interventions that we'll talk about include reinforcement, breaking down the task, using prompts, and fading prompts. So reinforcement. So ABA focuses on using reinforcement. This is what I love about ABA. So basically, reinforcement is using something that your child really, really loves to increase a behavior that we want to see, or to increase your child doing something that we want it to see. So we use reinforcement to teach new things. We use reinforcement to provide so much positive energy into the good behaviors that we might start reducing some negative behaviors. Reinforcement is basically how babies start learning how to babble and how to follow instructions. Right? Think about it. Why does a baby go get his bottle when you tell him to? Hey, look at your bottle. Because he knows once he gives you that bottle, he's going to get milk. That's food. He really wants that milk. So he's going to quickly learn that when mom says, go get that bottle, and I'm hungry, I have to go get that bottle because mom's going to give me food. Yummy, yummy, yummy. Right? This is how babies start learning how to babble too. Okay, right? If you think about it, your baby one of the first words your baby learns is probably like boo if you play peekaboo with him a lot, because he likes peekaboo. So he's gonna keep repeating boo because he wants it to happen again and again and again because it's really fun for him. Alright, so let's give you the definition of reinforcement. Really boring definition. So reinforcement is giving your child a preferred item or activity after your child does something we like to see. In the future, your child will now be more likely to do this behavior again. For example, every time your child looks at you, he or she gets something they really enjoy, like tickles. In the future, your child is more likely to look at you, right? Now look at you, mom, now. So let's think of another example of another child. So my baby really likes it when I say, yay! So I want her to hand the spoon in my hand. Okay, so then I make her put the spoon in my hand, and every time I make her put the spoon in my hand, I go, yay! Right, so every time she did what I wanted her to do, it followed something she really, really liked. So then the thing, putting the spoon in my hand, is more likely to happen again in the future. Alright, and it's kind of the same concept that we use as we teach kiddos. We might use the iPad for some kids to teach them how to look at the therapist. Or we might teach your child how to point to his juice to get the juice. We might teach your child how to say juice to get his juice. Right? The whole point of the reinforcement is that your child says something, like juice, and then it follows the juice. Okay? So ABA teaches your child by breaking things down into much easier steps. We look at very complex tasks and we break them down. We might teach each step individually, or we might teach all the steps together. Let's look at some more examples. So breaking down skills. Let's break down the skills of rolling a ball. Rolling a ball here, I made it into 5 steps. Who would have thought that rolling a ball had 5 steps? That seems insane, right? But it does, right? Rolling a ball, the steps are: 1, the kid has to get the ball. 2, the kid has to place the ball in his hands. 3, the kiddo has to look at the person that's going to get the ball. And then 4, the kid has to actually push the ball towards the other person. And the last step would be the kid has to see if the other person got the ball. Right? If they want to keep playing rolling the ball, the kid's going to have to see if the other person's receiving the ball. Oh my gosh. That is 5 steps for rolling a simple ball. Right? I know when I tell this to parents, they're like, oh, breaking skills down sounds super easy. I can do that. It's not that easy. Even these 5 steps of rolling a ball You can make these 5 steps into even longer 10 steps if your child really needs it. If your child really needs you to break these steps down even further, then your child needs it, and that's okay. It all depends on your child. Now, as far as like teaching this whole skill of rolling a ball, we might teach your child the first step first. Once your child shows that he can do the first step of getting a ball, then we might teach him the second step by itself, right? Once your child shows that he can do the second step of placing his hands against the ball by itself, then we might teach the third step all by itself, or we might teach the fourth step all by itself, or we might teach the fifth step all by itself, right? We might have to give your child lots of reinforcement for each individual step first before we put them all together. We might also have to teach your child what a ball means. Maybe he doesn't even know what the word ball means. So we might have to teach him that when I say ball, it means this round circular thing. Alright, so let's look at the other skill of brush teeth. Brush teeth has a lot of different steps as well. That's probably like 10 steps. And like I said, we could probably make these 10 steps into even longer steps. So brush teeth could be like 30 steps if we really get down to it nitty and gritty. I'm really bad with saying typical phrases. That might not be the correct typical phrase, but I'm bad at saying them. Anyways, if we get down to the nitty gritty, we might break down the brushing teeth sequence into about 30 steps. And that's okay, right? So now let me ask this question. Maybe you can think about it in your head. I'll answer it anyways. But what would happen if we tried teaching your child all of these brushing teeth steps all at once when they don't even know the first step? Think about it. What would happen if I tried teaching you your whole job when you don't even know the first step of your whole job? You're going to get really frustrated. You're going to get really mad at me. And you might throw something at me. That's how your kid feels too. Your kid might feel like, hey, you lost me at the first step, and you're trying to show me all these other steps. I'm done paying attention because the first step was hard. Right? But sometimes we don't think about those things when we're teaching kiddos. But that's okay. That's what we're here. That's what you have to help you with your kiddo. Alright, in ABA we'll also use the variety of prompting. Like you look at this little graph, there's 1, 2, 3, 4, 5, 6 levels of prompting that you can use to teach your child. And prompts are literally like little like hints to help your child get the right answer. And these are research-based as well. We use prompts to help your child be successful as possible. Okay, if your child is constantly making mistakes, they're going to get mad and they're not going to learn. I go back to the breaking down the skills. Imagine you being at work and I just tell you, you have to do all of these things. Or even if I show you, you have to do all of these things all at once. And then you get the first step wrong. And it's like, well, that's not right, try again. And you get the first step wrong again. And I tell you again, well, that's not right, so try it again. And then you get the first step wrong again. And I tell you again, that's not right, try it again. You're going to get really mad at me because you're constantly making the same mistake and I'm not giving you any help. I'm not giving you any hints. You're going to want to throw something at me too. I would want to throw something at me too. So this is what we use, these little prompts or these little helps or these little hints to help your child be successful so they don't make as many mistakes, so they don't get frustrated or angry or feel like they can't do it, right? So let's talk about the first prompt. The first prompt would be a verbal prompt. It's essentially a step-by-step narration is given to the student in order for the task or instruction to be completed. Verbal prompts would be more commonly used when your child understands the language. So for example, if I said, go clean up your cars, and then you kind of just stand there, and then I'm like, oh, he doesn't know what I mean by go clean up your cars. So then I might give you a verbal prompt of, well, pick up that red car and carry it over to the bin and put it in the bin. And I'd be like, oh, now pick up the blue car and walk over to the bin and drop it into the bin. Right? I'm verbally prompting you, I'm verbally telling you what you should be doing as you're doing it. Okay? We have physical prompts as well. So physical prompts, we have two types. We have full physical and we have a partial physical. A full physical is when an adult offers hand-over-hand guidance of the student to control or direct motor movements. This is commonly used when the child has limited knowledge of language and when the child has not done the skill previously. So full physical basically means that if I say, go clean up your car, and then you kind of just stand there and you don't do what I'm asking you to do, and you have never gotten up to clean up your car before, then I might walk over to your kiddo, hand over hand guide him to physically pick up the car and put it in the bin. Right? Because he doesn't know what to do. So even if I verbally prompt him, he wouldn't know what to do. So I have to literally go over there and show him how to physically pick up the car and put it in the bin. That would be a full physical prompt. Okay. Now we have partial physical prompts. So this is when an adult move the child's body in a direction he needs to go or towards a targeted object. So if you go back to go clean up your car, partial physical prompt might be used when, hey, you know, this kiddo has done this before a couple times randomly, so I know he can do it. So I might use a partial physical prompt. Every time I say, go clean up your car, I might just like literally just give him a little tap on his elbows or a little tap on his back to kind of get him going. All right, start walking towards the car. Or I might give him a little tap on his elbows to place it down in the bin. All right, I'm not physically guiding his whole body. I'm just literally tapping his body now to guide him to where he has to be. A model prompt is when an adult or another student demonstrate the task that is requested of the student. This is commonly used when your child can do the skill independently and can attend to adults or peers for longer periods of time. However, your child may still struggle to understand instructions. So, if we take the same example, go clean up your car. A model prompt may look like, I say go clean up your car, you can understand there, you don't know how to get going or how to get started. So then I, myself, walk over, I say, look, like this. I pick up the car, and I put the car in the bin. I showed you what to do. And after I showed you what to do, then your child, does it. So that would be modeling. I'm literally showing you what to do. Okay. Then we have a gesture prompt. A gesture prompt would be when an adult points or makes an action to indicate that the next step of a task or a direction is about to occur. So gesture prompt would be, say, go get your car, and you kind of look at me there. So then I just point to the car, like that one over there. Car. That would be a gesture. Or let's say you pick up the car, but then you kind of look at me with the car like, what am I supposed to do with it now? So then we just point to the bin to show you like, hey, you're going to put it over there. Then we have a visual prompt. So a visual prompt is when an adult points to a visual or an object that is the next step of the task or direction. So with the cleaning up the car, let's say I say, go clean up the car. So then I'm going to show you a picture of a car. And I should prompt you or guide you or cue you in that this is a car. Pick that up. Obviously, once we teach your child the skill with a prompt, we want to slowly remove the prompt. So this is what we call, we're fading the prompt. Our goal is for your child to do the instruction without any help. But to do that, we have to remove the prompt slowly. You know, at first we might use a physical prompt, then we might use a partial physical prompt, and then we might only need a gesture prompt. And then at the end, we want to be able to remove all prompts, which is always our goal. Sometimes parents, when they see us using prompts, they're a little taken aback because they're like, well, how's my kid going to learn when you're always kind of helping him? Well, it's the process. We're going to slowly take them away. Once again, when I say go clean up your cars, he always just stands there and look at me. So he obviously has no clue. So he needs some help so he doesn't get frustrated. Okay? Another thing in ABA here too that you should watch out for is an ABA provider should always look and see what prompt or what hint is going to be the most effective for your child. Every child learns different. Watch out for ABA providers that say, well, we're just going to give them a full physical prompt. That's what we're doing. Well, no, not all kids respond to full physical prompts the best. So, Johnny might respond to a gestural prompt a lot better than a full physical prompt. We'll leave it off there, and then we'll talk about reducing problem behaviors and how to teach alternative behaviors to problem behaviors at another day. How does that sound? I feel like 32 minutes is long enough. Well, bye. Hope you like this.